But if you're interested in using a peptide, you should be obtaining it by a prescription from a quality physician.
Exactly. And because we have bremelanotide, we can prescribe that for men as well. So sometimes we'll do it off-label for men who are having delayed ejaculation because it will help them achieve orgasm a little bit better. And so, this is available for premenopausal women. The other medication that's available for low libido is called flibanserin, also known as Addyi is the brand name. And that also works on serotonergic. It's got kind of a mixed response, serotonin and dopaminergic areas of the brain, and essentially works as a daily medication taken before bedtime, 100 milligrams a day, that actually helps with decreasing hypoactive sexual desire disorder. Works in about 45 to 60% of patients, and you need to take it for some time. Now, both of these are brand name medications, so they are a little bit costly, and sometimes insurance doesn't cover them, but they are available, and I think very few people know about them, and I think they're really great and useful tools in the toolbox.
And these are for desire.
They're FDA approved for what we call hypoactive sexual desire disorder, which is essentially low libido that causes distress and bother.
I don't want to take us off course about vaginal lubrication, arousal, and female orgasm, but as long as we're talking about arousal and reduced arousal that requires treatment, I have to ask this now. Anytime we talk about arousal and libido, there's no BMI. Which, by the way, the body mass index is probably not the best tool either, but there's no chart. It's not like a thermometer that says you're 98.6 plus or minus 2 degrees, you're good. If it's too high, much higher than that, you have a fever. If much lower than that, you're hypothermic. So my understanding, I don't want to say naive understanding, but my understanding is that one determines whether or not their libido is normal, high, or low, largely based on some intuitive understanding of what their partner or partners desire, whether or not they can meet those desires. And if they sort of accrue enough of a sample size, they date enough people where they have sexual interactions, they figure out over time whether or not they have a low, medium, or high sex drive. And people tend to compare to how they felt in earlier years or at different times of the year or under different psychological conditions and stress conditions, that kind of thing. Right. But we really don't have a benchmark for this, right? I mean, we can't say that, for instance, that if people are not desiring sex or thinking about sex with blank frequency, that they have low libido, right?